Bruxism is a set of tensions felt in the mouth at one time or another in life. Teeth grinding, especially at night, is one of the causes of bruxism, but it is not the only one. Clenching of teeth and the tension felt in the jaw, masseter or tongue muscles are also part of the bruxism. Bruxism can occur both during the day and the night. Nocturnal bruxism is often associated with stress, intense concentration and/or nervousness, and tension, such as in traffic jams. The resting position of the jaw is as follows: a slight gap between the upper and the lower teeth. The tongue is positioned on the puck, on the so-called rough part, behind the incisors. The lips are pressed together and the position of the shoulders is relaxed. As an example, this is the exact same position as if you wanted to blow a light draught to cool your soup that is a little too hot. The jaw is a suspended joint. This means that the human beings are not supposed to have tension in this part of the body. However, tension can occur as a result of specific cues such as chewing or speaking. Wondering if it's serious? Not at all. This is a normal physiological reaction that the brain triggers when it feels attacked. Stress is a particularly sensitive aggressor for the brain. If you want to reduce your bruxism, your pain, or the wear of your teeth, you should try to work on the stress component present to reduce it as much as possible. Bruxism is an oral behavior characterized by involuntary clenching or grinding of the teeth. In epidemiological terms, it affects between 9 and 48% of the population. This wide variation is due to difficulty of establishing a firm consensus on the diagnosis criteria, in particular because it is primarily a behavior often assessed by clinical observation or self-assessment. Unlike temporomandibular joint (TMJ) disorders, which are better defined, which affect about 15% of the population, with a higher prevalence in the women, bruxism is more difficult to identify and it varies according to the context. It's behavioral, biological, or psychosocial. Bruxism is divided in two main categories: awake bruxism, which occurs during the day, often in response to stress or concentration, and sleep bruxism, which occurs during the night, sometimes reported by the partner due to the noise generated. There are also 4 specific forms of bruxism. 1. Clenching, which is strong and often involuntary contact between the teeth. 2. Squeaking, mostly seen at night, often audible. 3. Bracing, which is muscle tension without dental contact, typical of moments of stress. 4. Thrusting. There is jaw movement without dental contact, often observed in the elderly or under certain drug treatments such as muscle relaxant and antidepressants. Bruxism oscillates between a simple behavior and a pathological disorder, depending on the context. In children, for example, it can be considered a normal physiological process related to the growth, while in adults it can become a risk factor if it's associated with pain, dysfunction, or tooth wear. It can even be considered as a protective factor. Indeed, current studies are exploring the possibilities that bruxism is beneficial for certain pathologies, such as sleep apnea, by increasing the permeability of the airways. The interpretation of bruxism has evolved. Previously considered only a bad boy, a harmful behavior, it is now perceived as more complex. The key is to understand the time and context in which it occurs. Daytime bruxism, for example, can be beneficial in short term by improving concentration, but it becomes problematic if it persists for too long. Nocturnal bruxism in children is often considered normal and beneficial. If we want to talk about causes and comorbidities, bruxism is mainly of central origin, i.e. the brain is the starting point. A distinction can be made between 1. Psychological causes, like stress, negative emotions, or unmanageable life phases that are often triggers and especially for bruxism when you wake up. 2. Biological causes, genetic or neurochemical factors, or sleep disorders like obstructive apnea can also cause bruxism. 3. Social causes, alcohol, tobacco, drugs, caffeine, and certain medication, such as sleeping pills, antidepressants, are often involved. Dental interference has long been thought to be a cause of bruxism, but this theory has been ruled out by recent research. Bruxism is now considered to be a behavioral linked more to a psychosocial factors than to the dental factors. The consequences of bruxism can range from mild to severe. From dental point of view, there can be fractures, pain, loss of implants. Periodontal, which is gingival recession, bone loss, and tooth mobility. Morphological, hypertrophy of the masseter, bone exostosis, tongue indentations. Muscle and joint, intermittent pain and blockage, especially when waking up. The evaluation of bruxism is based above all on a detailed history focused on the patient's habits and potential risk factors, gastroesophageal reflux, sleep disorders, psychoactive substances. Intraoral and extraoral examination detect the associated clinical signs. Tools such as STAB, which stands for Standardized Tool for Assessment of Bruxism, or the Bruce screen, can also be used to simplify the practitioner's assessment. Awake bruxism is often unconscious and involuntary, making awareness crucial for the treatment. Let's talk about therapeutic approaches in bruxism. Awake bruxism is often unconscious and involuntary, making awareness crucial for the treatment. The approach is based on a patient education and de-dramatization, often through cognitive behavioral therapies such as biofeedback or applications such as Bruxapp. Patients with nocturnal bruxism benefit from techniques designed to improve sleep quality. The more time a patient spends in deep sleep, the less likely they are to grind their teeth. Devices such as dental aligners can protect teeth, although they do not prevent bruxism as such. More invasive treatments, such as Botox, can be used to relieve muscle pain, but they do not change bruxism behavior. Some medications, such as clorazepam, may be prescribed, but they have a risk of dependence or worsening sleep apnea. In conclusion, it's a double-edged sword. Bruxism, although often perceived in a negative way, can be seen from a new angle. Depending on the context, it can be beneficial, neutral, or problematic. The goal of bruxism management is to tailor treatments to the specific needs of the patient while considering bruxism as a continuum of muscle tension, the intensity of which can vary depending on internal and external factors. Education and risk factor management are key to preventing bruxism from becoming pathological. The key message here? Bruxism should not be systematically considered as a disorder, but as a sign or symptom of muscular and behavioral balance to be monitored and managed according to the manifestations.